So I think that there's a lot that can be learned from the medical publication professional area. This is an area that I went into about 4 years ago, having been a consultant, and I was very surprised to realize that this is a very professionalized field that has its own set of ethics, its own set of guidelines, and standards that are really trying to maintain a certain level of integrity in their reporting of findings. And for health economics and outcomes researchers, making this connection with this world, I think, could benefit them tremendously. To the extent that they do research and they're not able to disseminate it, communicate it properly and in an easily understandable way that's meaningful to their audiences, they're really not getting the full value out of their research. And so working with this group of professionals, they can really more effectively deliver their information to the right audiences that need to hear it at the appropriate time and the appropriate venue.
We have to really educate people that the role of the publication professional is not the same as an English editor who is typically involved at the end of a manuscript and polishes the English. Professional medical writer is really involved at the very beginning of the manuscript preparation process. So they will work, for example, with your health outcome specialist, looking at the data and saying to the health outcome specialist, okay, how are we going to communicate these data? How are we going to make sure that we choose the right journal? How are we going to make sure we comply with the journal requirements? How are we going to communicate your beautiful data, but complex data, in a very digestible format and content that can be understood by your target reader?
At least have been very fortunate to work with companies where I have had the ability to integrate health economics group individuals to work closely with publication planners, and so we support them, and at the same time we are learning from them. And I think because of that integrated approach, we've been able to disseminate the information quite nicely, and also to the right target audience at the right time.